of these go in, which is awesome.
Yeah. Um, well, thanks for being on today. Today we're joined by Dr. Capella. She is a pediatric DPC owner and does some consulting around a pediatric DPC for other owners. And it's a very unique space. The more I'm learning about it in terms of challenges and attracting patients and serving them. So today we're just going to talk about like overall building a sustainable family focused practice. And so talk about your background and those types of things. But I'd probably butcher a background because you know more about yourself than I
Hmm.
do.
Hmm.
But I'd love for you to just introduce yourself a little bit, and I'll introduce myself, and then we'll kind of jump into some questions.
Sure. So, I mean, long story short, I practiced as a general pediatrician and an urgent care pediatrician for about 7 years out of training in a couple of different places. I worked at a community health center in San Diego, California. Then I moved to Utah and I worked for a big health system in their pediatric urgent care systems. I also had moonlighted in pediatric ERs and I just felt like probably in like it was 2020, 2021. I just really started feeling disillusioned with the whole field of medicine and the way that the insurance-based system of practicing medicine, essentially. As a pediatrician, I think we also have it a little bit well, I feel like we have it the hardest. We get paid the least, and we have to see the most patients per hour of all the fields of medicine. And it can just, it's a recipe for burnout, right? You know, we went to medical school, we did residency, we came out with the same amount of debt as other physicians, and yet we're, being paid the least and being burned out the quickest because of the pace at which we have to see patients. And so I just thought there has to be a better way. I don't know that I'm going to be happy just doing pediatrics this way forever. So I started looking for what else there was, and I applied for some academic medical center jobs, and I didn't get them, but the frustration of not getting those jobs is what made me really seriously consider DPC and go looking for something different because I thought maybe there is no perfect job out there that's going to make me happy. Maybe I have to create it so that I can help make myself happy as a physician for the rest of my career. And luckily, I stumbled upon direct primary care, this model, this membership based model, where instead of relying on insurance reimbursements, which are getting worse and worse, and therefore pushing us to see more and more patients, maybe I can rely on this membership fee to sustain my practice and which will allow me to have more time with patients, to have a more personalized relationship, to practice in a more holistic way, which had attracted me. So
Yeah.
in 2021, I opened my practice called Healing Arts Pediatrics in Salt Lake City, Utah. I was the first pediatric DPC that did in Salt Lake County and possibly the state. There weren't others that I knew of at the time doing it.
Yeah, it's still a fairly new part of DPC that more pediatrics are now starting to open, or people are leaving, traditional
Mhm.
pediatrics to start their own DPC.
Yeah.
I also like that DPC can work for both primary care and pediatric care, so it could be
Hmm.
direct pediatric care. So
Yeah,
you can save the same initials for both of those, which is
exactly.
awesome.
Yeah.
That's awesome. Yeah, your journey into it. There's similarities between other people who are burnt out with traditional medicine, but everybody has a little bit of uniqueness, I think, to their story, and I love
Hmm.
that. I'll share a little bit about myself for those that are joining if you haven't been to one of our webinars, but my name is Nate Goodman. I'm a CPA, and we run a CPA firm that's specifically focused on providing resources and content to the direct primary care space, as well as services for people that need help with their back office, monthly accounting, payroll, taxes, specifically focused on DPC because I really believe in what you guys are doing. You're totally and radically changing the healthcare system in America, kind of taking it into your own hands instead of trying to say, it's somebody else's problem, and really restoring the relationship between doctors and patients. And I have been a benefactor of that in my family, my young kids, and it's radically changed my own life and now my employees' lives because they're also part of DPCs as well. And we get to basically say, hey, we want to be part of this movement too from what we can do. We can't be on the front lines doing what you guys do, but if we can relieve stress and burden in the back end, that's what we're here to do. So we build these webinars as hopefully a place where there's healthy conversations that spur people to either start or jump into the movement. And also if people have questions that might be struggling as they've been running their practices, to be able to maybe find those one or two levers to pull that can help change the tides of their business. So, and pediatric DPC, I was actually at a mastermind a week and a half ago, and somebody spoke up and said, pediatric DPC doesn't work. I tried it and it won't work. And I was really disappointed to hear that, and to say, hey, I think there's probably, instead of just throwing in the towel, inviting other people in to and be a little vulnerable to say, hey, what am I doing wrong here that's working for others? Because I am seeing pediatric DPC work. And so starting to open up that conversation. So hopefully today we can talk about your journey too, of struggles and good things and bad things of the finances, and really help people, hopefully encourage people in their journey. So my question now to you would be, you shared a little bit of this, but what would you say was like the ultimate thing that led you from traditional pediatrics to start your own DPC practice?
Yeah. I think two big themes, and that's just sort of the autonomy, freedom and autonomy that I just couldn't find in the insurance-based healthcare space with a big employer. And then sort of that schedule autonomy and that autonomy to do things the way that I thought was best for me and my patients. And then related to that, the freedom to also practice in a more holistic, more grounded, more humanistic way, because I feel like when we have these really rushed visits, you have so little time that you almost have to just focus on a few superficial things instead of really focusing on the person, the human being that is a compilation of social factors and physical factors and relational factors and environmental factors, the human being in front of you. And so I think those were the two big things that really drew me to this world of DPC, that autonomy and the freedom to practice in a more humanistic way.
Yeah, I love that. So then you made that decision in your mind, you started making movements towards it, and you're sitting there kind of right before launching. What kind of concerns or uncertainties did you have right before launching?
Oh, a ton. I mean, I'd never owned a business, right? I think physicians, we're highly capable people, right? Like, we have been through the pre-med years, we've been through medical school, we've been through residency. If nothing else, we're very good at learning. And so I thought, well, I have never been a business owner before, but if Joe down the street can own a bike shop and John down the street can own a sandwich shop, like, I can own a business too, right? And it's a micro practice. It's not this huge hospital system with like layers and layers of complexity. It's a single physician practice, right? It's very doable. And of course, I leaned on some supports. I went out and I read some DPC books that others had paved the way with. I listened to some podcasts. I got the information that I could. I did a lot of searching online, and how do I structure and register my business? How do I do this? I got the checklists. But there was still a lot of fear because I'd never done it before, right? And also there's the big looming question of, will this work in my community? Will it work for me, right? Because every physician has their own personality. I'm very much an introvert. I don't like being in front of people, or if I do spend a lot of time in front of people, then I need time to recharge. But when it comes to things that I really care about, I'm able to stretch myself and do what's necessary to make it work. And I thought, okay, level of motivation here is high. Number of fears are also high, but I think I can make this work. And if I just keep putting one step in front of the other, going down my checklist, figuring things out, remaining open to new ideas, then I think I can make it work. But I think the biggest fears were just around, is it going to work in my community? And also the big one was, how long is it going to take? Because you hear in the DPC community a huge range of stories, those with instant success, and then on the very other end of the spectrum, really slow growth, and for some people to the point where they had to close their DPC practices. And so I just didn't know. It was a big leap of faith. Like, okay, I think my heart is telling me that this is the way to a better future for me and my practice, and that because I'm the first one in my community, especially, that the potential for success is there. The people are out there. I don't live in a tiny little town with, people struggling to make ends meet. I live in a robust community, Salt Lake City, Utah, lots of different income levels, enough people that have enough disposable income that they could consider this type of practice for them, for their children.
Mhm. Yeah, so there's and I think you hit the nail on the head, is like most physicians are very bright and smart people. Like you have come so far in your career, and but because you've practiced and done one thing in your profession and built that and gotten really good at it, there's
Mhm.
almost, I think this happens with anybody in any profession, you start to, there's this imposter syndrome of like, well, can I do the marketing piece that I need to,
Yeah.
have branding and have a place? Can I have the sales conversations where I'm talking with
Mhm.
prospective patients?
Yeah.
And the answer is yes.
Uh-huh.
And it's just this overcoming of, it's not what I used to do every day, all day,
Mhm.
but I am capable.
Yeah.
And I love that. It was like, it's a hesitancy, but also you had the confidence to know, like, I can do this because look at what I've
Uh-huh.
already overcome.
Yeah,
Like
exactly.
very few people make it to where you guys make it.
Uh-huh. Yeah.
So if
And
you can make it to where you're at.
when I did have some of those moments of fear and terror, I would remind myself of some of those moments of fear and terror in my pediatric training. Like the very first time I had to take care of a baby in the neonatal ICU that weighed only 1 pound and had been born, 3 months premature. Or the very first time I had to insert a needle into the spine of a premature baby to do a spinal tap. Like those were terrifying moments, but I did them anyway. And so I thought, okay, this fear, this
Yeah.
feeling of fear is not new, right? And the only decision, the big decision for me is, am I going to let that fear keep me from doing something that could ultimately lead to a lot more satisfaction, a lot more joy, a lot more professional fulfillment. And I think that's where, since I do have a business now that kind of like coaches and helps other pediatricians and physicians to start their own practices, I see that fear holding a lot of people back. And I mean, fear is there to protect us, right? Fear is there to make sure that we are careful and cautious about going forward. You certainly don't want to just say, oh, yeah, I'm just going to open my business tomorrow and expect all the patients to come and set yourself up for failure, right? You have to do a lot of the work to set yourself up for success. But fear in and of itself should not be the limiting factor, the thing that keeps you back from going this route if you feel called to it.
Yeah, 100%. We use the Enneagram at our on our team to like highlight. We
Uh-huh.
have a 6 on our team who like very much worst case scenario, and it like the fear is good. Like it
Mhm.
does help you identify like weak points, right? Of like, oh, that's something I need to address, and that's something I need to address, but not allowing
Mhm.
it to control the decisions that you make.
Yeah.
Um, so let's some nuts and bolts of differences in DPCs. So, what would you say is like a big difference between pediatric DPC and adult DPC?
Mhm. Yeah. Well, first of all, I think every specialty has its own kind of unique culture, right? We have stereotypes about the people who go into emergency medicine versus the people that go into pathology versus the people who go into, whatever, for surgery versus pediatrics. So pediatrics has its own subculture. Is it an absolute? No, but there's a subculture there. And so it's funny because when I entered the world of DPC, I first kind of encountered the family medicine, internal medicine community of DPC. And it was almost this like cowboyish sort of like subculture of like, we're the small town docs, we're doing it all ourselves. We love doing procedures. We do. But what I was looking for was more of the integrative pediatrics, more
Yeah.
holistic approach that blends the best of modern medicine with age old healing modalities. And so I thought, oh, I'm not really finding that in here, but that doesn't mean that it won't work. It's just that I sort of have to pave a little bit of a path for myself. And I eventually did find those people, the few and far between throughout the country who were doing what I wanted to do. And I've created a little bit of a community around that. But um, so the subculture is one big factor, right? The other thing, well, maybe a couple of other things vaccines are a huge, huge impediment for pediatricians who want to go the DPC route, because when you're dealing with babies and young children who need a ton of vaccines in those first few years of life to protect them, that's a huge cost. And when we are not credentialed with insurance companies, we cannot bill insurance for those vaccines. So if you look at just the first year of life, the normal vaccine schedule, it's about $2,500 of vaccines that we are administering to a baby potentially. And so that's a huge cost. The startup costs of getting a vaccine supply, an initial stock of vaccines plus your vaccine refrigerator and freezer plus your temperature logging systems is about $15,000. And so that was a big expense for me to take, and I couldn't do it in the beginning. So my first year I was referring patients out to the health department or to their old pediatrician to get vaccines, because I would explain, I'm so sorry, I will provide everything else, but I'm not at the point yet that I can offer vaccines. And then luckily I partnered with another pediatrician who shared my office. We both started at the same time and we were sharing overhead. And we were able to go in on the vaccines together. And after about a year and a half of our practice. And so we absorbed the costs for a while. And then ultimately we were able to get VaxCare, which is sort of like a third-party vaccine supplier that bills insurance through their own contracts. So the vaccine issue is a big one. It's a big hurdle for pediatricians to jump, and there are lots of different solutions. None of them are perfect, in my opinion. But it doesn't mean that you can't do it, though. And I hear too many pediatricians letting that hold them back. And it was annoying for some of my families to have to go to the health department, but it wasn't impossible. And they still valued the quality and the relationship and the care that I provided enough to think that I was still worth it.
Yeah, for sure. And the guidance there, I can speak from experience on that one because our DPC owner didn't have vaccines. And so we drive, 30 minutes to the closest health department and to be able to do that. But the doctor we had 45 minutes, right? So our initial hesitation of like, well, how do we do that? He's like, it's actually really easy. You go here, you can schedule your appointment and you walk right in, and it's a really nice facility. And it was like, all the hesitations for us was like just the unknown. But because you had the time to explain it, it was like, oh, we can do that. And I would rather do that. And you give us advice around it and help us have a better understanding than a 10-minute, like, here you go.
Yeah, exactly.
So
absolutely.
That was a big plus. What would you say? Go ahead.
Let me add one more thing. Sorry. The other big thing is I think that the value proposition for getting pediatric patients is a little harder, because when you're marketing to mostly adult patients, by the time you're an adult, especially, in your late 30s, 40s, 50s, you've had enough interactions with the healthcare system that most people have had frustrating encounters, right? They've seen the wait times. They've experienced the 5 minutes of face-to-face with their doctor without getting all their questions answered. They've encountered the having to wait weeks to get their lab results because of communication issues, right? Or they've had other negative experiences. Like, I've seen this doctor and they didn't listen to me and I had to go to this doctor, and then it took me forever to figure this out because I felt like nobody was listening. So it's easier to make the sell to an adult who's had enough of those frustrating touch points along the way that they're ready for something different. When it comes to babies who are otherwise pretty healthy most of the time, and it's the decision for parents who are now experiencing the financial stress of having to care for a child and all the expenses that come with it. When it comes to making the sale to parents of healthy children who think, well, I only, my 3-year-old is fine. They only need an annual physical and they don't get sick that often, or my teenager just needs their annual sports physical, it becomes a harder sell. And so the marketing in pediatrics can be a lot harder than in adult DPC.
I feel like I've got a host of questions around that. So what would you say since it is such a different value proposition, what is the value proposition that you have made that you've seen start to, gain some traction around the patients that you have been able to attract?
Yeah, I think a big part of the marketing for pediatrics is that you're selling peace of mind, right? You're selling um the relationship which comes with peace of mind, that the parents who are members of my practice that bring their kids to me, they know that, okay, maybe my kid is healthy 95% of the time, but that Friday evening when my toddler is crying in pain and can't go to sleep and I'm worried about an ear infection, I don't have to go wait 3 hours at the local urgent care. I can text my pediatrician and get some advice and, to help calm me down, right? Or
Yeah.
or I can send, the parents of a newborn and they're like, my baby just had this really weird stool, this really weird poopy diaper, and like I don't know if it's normal. And I know that I can text my pediatrician a picture of that and say, hey, like I don't know if this is normal or not. Is it normal? And then just get like, one or two text messages back and forth for that peace of mind. Or a parent just texted me 10 minutes or right 10 minutes before we started this webinar. And she said, hey, I just realized my teen daughter is out of her EpiPen. Could you send a refill? Like, yes, absolutely. Right. You don't have to schedule an appointment for that. You don't have to try to call, a phone tree and be on a frustrating 15 minutes with a medical assistant who doesn't know, who doesn't know
Yep.
you to try to figure it out and then wait 4 days before the doctor finally gets around to sending that refill. I just did it, so it's really important that pediatricians they really approach marketing from that perspective of I'm selling the relationship and the peace of mind that comes with that. And the numbers aren't always going to make sense from a purely visit perspective, because I've had parents say, well, if we only come twice a year, but this is how much we're paying. And I have had to get comfortable saying, but you're paying for the access. You're paying to know that when you need me, I'm going to be there and I'm going to respond relatively quickly. And I'm going to spend more time with you resolving the concern than another physician would.
Yeah. I think recently there's been more and more research coming out on the cost savings that are driven from the DPC relationship.
Yeah.
That we've started advocating more for also bringing in the financial piece of, even if you're on traditional health insurance and you choose to go with a DPC membership on top of your insurance,
Mm-hmm.
the savings are still $80 to $100 per month of all like claims that people make out there when they work
Mm-hmm.
with DPCs because of that relationship. You can help advise on, hey, well, you could get that prescription, or there's actually this other option that's the same thing but cheaper, or you can go to this place for that procedure. Even with kids, that generates significant savings. And I love both the access and availability is very important. And there's true nuts and bolts numbers to it that make it make sense.
Mm-hmm.
But I think being able to have in any conversation you have, whether it with like for us when we're talking to prospective clients, when you're talking to prospective patients, there still is that element of a sales conversation. And sales sounds, I don't like that term because it sounds so transactional, right?
Mm-hmm.
But there is still, hey, they have questions and I'm trying to help them understand what they're paying for and what the values are and what the boundaries are
Yeah.
to this relationship. Because the value is there, you know it. It's just how do we communicate it to people who don't
Mm-hmm.
know what the model is.
Definitely.
Um, we've used other things like, hey, if you pair your take away traditional health insurance, if you were to say, I'm viewing the DPC membership with a like an additional cost sharing as my family's medical coverage, the way that we receive medical care, you save a substantial amount on your medical expenses every year if you pair your DPC membership with another medical coverage outside of
Mm-hmm.
just traditional health insurance.
Yeah.
And so it's like, even if I don't use this ever, it's like
Mm-hmm.
this is 10 times better, like in terms of your bullet point of benefits.
Yeah. Yeah.
It's better than what you would get under traditional. So
Yeah. Well, and
um
even if you think about like what we pay for with health insurance, a lot of what we're paying for is that peace of mind, right? When I was on a high deductible, health insurance plan when I first opened my practice under the healthinsurance.gov Affordable Care Act plans, I was paying like, $600-700 a month. And that was with an $18,000 deductible that I wouldn't even get any coverage until I paid $18,000. But I still paid it because it was like, well, what if I'm in a car accident tomorrow? What if God forbid, my husband or I come down with cancer? What if something terrible, an accident happens, right? And I just wanted that peace of mind. Now, unfortunately, those costs kept going up and up. And so eventually we switched over to a health share called Zion Health Share, which is relatively new, but it costs us only like $320 a month. And we
Yeah.
don't use it. We haven't used it in years, but it's that peace of mind that we're paying for, that if something happened catastrophic, we would have some safety net, right? It's not as safe as traditional insurance because a little more restricted, but it still is some safety net that would help us pay for catastrophic health insurance needs or health needs.
Yeah. What, being in the consulting space and you work with other pediatric DPC owners, what mistakes do you see other pediatric DPC owners commonly making?
Yeah. Um, One that comes up quite often is spending too much money in the beginning because most of us come from these nice practices that have all the bells and whistles, that have all the equipment, the vision screener, the hearing screener, all the vaccines, the suture supplies, etc. And I made that mistake in the beginning of buying too much stuff that I didn't really need in the beginning. And that meant that my startup costs were higher than they needed to be. Now, luckily for me, my practice has, it took a while, but eventually took off and it thrived, and now things are great. But I probably could have like paid myself sooner and a little better if I hadn't invested so much in things that I didn't necessarily need in the beginning. So I think one of the mistakes is spending too much money up front, and whether that money is on SEO or website or your supplies or your clinic or your rent or whatever it is. It's not to say that you don't need certain things. It's just to say that you have to make wise strategic decisions about what you truly need in the beginning versus what you don't. Or maybe you can start out sharing a space with someone when you hardly have any patients, and then after a year you can move into your own space. Or maybe, you can share an office with someone else who's also in DPC, or maybe you can rent a single room from, a psychiatrist's office or things like that. You want to be strategic about, because too many of us, we're dreaming big and we imagine this beautiful dream practice. And you have to realize that maybe not all of it is going to actualize right away. Right. So
Mhm.
that's one big mistake. I think the other big mistake is really in the whole avenue of marketing, just like we were talking about. We've never, as physicians, typically had to market ourselves before. We've never had to step into that space of, hey, pay me money, and I'm going to tell you exactly why I'm worth that money, right? We were always kind of sheltered behind these big systems or these big clinics that have their own billing departments. And when patients had questions about money, it was like, well, go talk to the billing department. I don't know the answer to that. Go talk to the billing department, right? And so I remember when I was first setting my prices, I priced myself too low. And eventually I had to raise my prices in order to make it work. But the first time I was saying, hey, an hour of my time is worth $300 because that's my overhead plus my staff plus all the supplies plus my
Yep.
malpractice and all of that stuff, right? $300. And I had to say it very confidently, and it's been a work in progress, right? The more I do it, the more I'm able to say, hey, this is just how much it costs, right? When we go to like a car repair shop or we go to buy a new MacBook, it's not like Apple is trying to convince us all that hard that like their product is worth it. It's just the price is what the price is. They're not gonna feel bad about putting a certain price on their product, right? And so
Yeah.
I think that's a really uncomfortable thing for a lot of physicians, is to just set your price and be confident about it. And then also do the legwork that it takes to get the word out there, whether that's asking people for Google reviews or testimonials on your website, or doing social media posts, or going to community events, doing whatever it is you need to do to spread the word about your practice. Because my experience being an introvert was that first year was really slow, partly because I had to get comfortable with putting myself out there. It was not something that I had really had to do before. And so it took me longer to grow my practice partly because of that. And part of it is just I was new in my community. I was the first one. This is, the whole value
Yep.
proposition. People are so accustomed to using their insurance for pediatric care. And so it was just, getting that word of mouth out there and helping people to understand what it is that they were paying for. And then after a while, word of mouth really started to spread. And that does half of my marketing for me now. But I still have to expend the effort to get the word out there and continue to do that. Because just because you open your doors, it doesn't mean that people are going to come flocking. You could be the most amazing physician and have the most amazing practice on earth. And if nobody knows about you, you're not going to have patients.
Yeah, that's right. You gotta takes a lot of work, and the other person that's like at the center of that, making sure it's happening, is you.
Yeah,
You got to
exactly.
be the one to knock on doors and join the Facebook mom groups and the other
Exactly.
things to get the word out. I
Yeah.
Whenever I talk with other DPC doctors starting out, I always think about when I used to be in high school. I used to have to go sell ads for
Mhm.
being able to like support our sports team. And
Yeah.
so I would go like door to door to businesses and give them my like I made up something, as a high school. I was like, you want to pay for my high school basketball team? You'll get clients maybe. And but there's the part of it that is that mentality that you get a little scrappy and say like, I want to make this work. So like I believe in myself and I'm going to go and tell people about what I'm doing. And you'd be
Mhm.
surprised how many people have issues with something related to their own health.
Yeah.
Right. So it's like, oh, that sounds amazing to have
Mhm.
that. So being
Yeah.
scrappy and being able to get after it in different
Mhm.
ways depending on your community.
Yeah.
So,
Speaking of that scrappiness, thinking about my practice, this isn't what everyone has to do, but I think everyone has many people have a version of this in their own way that I had to get creative. I trained myself how to do autism evaluations so that I could also offer those, and they were higher ticket or like higher price, and so it would help me a little bit with like lump sums of money coming in every so often. I also offered one-time visits for the first 2, 3 years of my practice. That it was a sort of, I called it a try it out visit. And it wasn't like you could use unlimited try it out visits. It was like maximum 2, but it was like so that you get to know me. And then if you like my service, if you like the relationship, if you like my style of practice, then you can opt to jump onto a membership. But I limited it because I didn't want it to compete with my membership, and I priced it higher. That was the 300 for, 1 hour visit. I eventually got rid of that because my memberships were growing enough and I was getting busy. And then I didn't like having to keep track of, oh, wait, are you a member or are you just,
uh-huh.
a fee for service? And it gets messy. So I did it for as long as I needed to. But that was one way of being scrappy, of being like, what do I have to do to make this work in the beginning? And I also started doing immigration medical exams, mostly on adults
Mm,
because it's mostly adults who need them. But it was an application through United States Customs and Immigration Services. And for people who are in the final stages of getting their green card, they have to go through this immigration medical exam. It was $1,000 fee to the government and then process of paperwork. And then I got approved. And as soon as I got approved, people started calling me because I got listed on the official USCIS website as someone who can do these exams. So it was free marketing.
yeah.
I taught myself how to do that. I stepped out of my comfort zone to see adults who I hadn't seen in a long time. And I actually am still doing that. I only do a couple per week now because my pediatric practice has grown, but both me and my pediatric colleague who share an office benefited greatly during those first 2 years when our pediatric growth was really slow, which it can be because of the things I've mentioned. Um, it helped us a ton. It helped us to bring in enough revenue to start paying ourselves, to pay our overhead, to eventually move into a new office. And it's something we continue as kind of a service for our community because we've been very successful at it. And the immigration lawyers actually liked us so much that they tell people about us. And so it's a little bit of a side gig, but the point being that sometimes you do have to be scrappy, like you were saying. You have to say, if I really want to be independent and make this business work, what am I willing to do, even if it's just temporary, to make this business thrive? Because you have to have the revenue to thrive in order to keep doing what you want to be doing and to continue to refine your practice in the way that you want it to go.
Love that. So talking about pricing, you said you had to think through pricing a couple different times.
Yeah.
How did you originally determine your pricing structure? And then how did you determine your new pricing structure?
hmm I had read the DPC books, and they basically say to kind of do the math backwards. So they say, how big of a panel do you want? For me, my sweet spot felt like 250 to 300 patients. And so I kind of calculated based on, I think, 300 in the beginning. And then they said, okay, how much do you want to pay yourself? And then estimate all of your operating costs, your monthly overhead, how much
Hmm.
is your malpractice, your professional memberships, your accounting, your your rent, your utilities, all
Yep.
that stuff. So you add up all the numbers and what you want to pay yourself. And then so let's say it's 20, or let's say it's 30,000 a month, your salary plus your overhead. And then let's say for me, it was like, okay, I can take a maximum of 300 patients. And so 30,000 divided by 300, that's $100 a month. So pretty easy math of like, okay, on average, I have to charge $100 a month per member in order to make this model work. Now in pediatrics, we often have age tiered pricing. So a newborn has a lot more visits in that first year of life compared to a teenager. And so I had like the first year of life tier, and then age like 1 to 3 tier, and then 3 above. People do it in all sorts of different ways, but I wanted to keep it relatively simple. So like infant, toddler, and everyone else. And so my infants are priced at 200 a month. Toddlers are about 150 a month, and then everyone else is 125 a month. So, but when I started, my numbers were lower. It was like 125 a month for newborns and only 75 a month for older kids. And I realized that once I started, especially, I got my board certification in integrative medicine. I offer hypnosis, I offer massage therapy. So I realized I was trying to offer way too much under a very low fee structure.
Yeah.
So I had to up my prices, and I actually had to put a maximum. So now I wrote into my contract after 2 or 3 years that the essentials membership covers up to their annual physical and up to 5 sick visits per year. Because otherwise I offer so much that people would think, oh, Dr. Capella can see my kid for therapy every 2 weeks because she's really good at dealing with kids with anxiety. And yeah, we'll come in for an hour every 2 weeks. That just the math did not work. And I had to basically enact more limits. I do now have a premium membership for those kids with higher needs. And so if they want to come in every 2 weeks for therapy, yeah, I can do that, but we're going to have a custom fee for you to make sure that that works for both of us.
Yeah. Yeah. I love that. Kind of basically like scale for people. It's like, hey, do you need more? And
Yeah.
you have a way to kind of conceptualize it too, where it's like
Mhm.
we can do that, but there
Yeah.
is this very clear listed on your website
Uh-huh.
boundary too.
Yeah.
Something that's common is scope creep, where it's like, oh, I'm paying you this monthly fee. So some people are like, I want to take advantage of it every single
Oh, for sure.
month.
Yeah.
And you're like, hey, this is the goal is for you to be well. Like we
Yeah.
both do really well when you're well.
Yeah.
So,
Exactly.
but they
Like
can
you,
clearly then see it's like, oh, I'm choosing the essentials, which means I'm saying no to something. Which
exactly.
that's something a lot of practice owners don't have is like, hey, there
Mhm.
are things that I won't do consistently, and there's having that kind of clear, here's what you're gonna get,
Yeah.
layout for people. That way, you as an owner, especially if you're the only owner, there's not that wall of medical
Mhm.
assistants and admins that are protecting your time.
Exactly.
So it's like you have to be able to set those boundaries, and a great way to do that's the here's what you get and here's what you
Yeah.
don't get.
Exactly. Yeah. And I do see a bit of a gender divide in the DPC community on this front, if I'm honest, that I think women, patients for some reason, just because of I like the culture and socialization, I think patients expect sometimes more from women, or they're more willing to walk all over. Or like, I don't know. There's just something unique. And so I do see more DPC women physicians starting to put in the boundaries around their memberships like I do, or have different tiers of like, hey, this basic tier covers like this reasonable amount. But if you want menopause care, if you want the integrative, the functional, if you want certain things, or even doctors, both male and female, who do osteopathic manipulative treatment, which is what DO physicians were trained to do in their training. I mean, they can help with migraines, they can do help with back pain,
Hmm.
they can do these other things that physical therapists might need to be used for a doctor who doesn't have those skills. So they have to charge higher if they're kind of putting these add-on services into the memberships. I think being smart about that from the beginning is something that I would advise, but not being too afraid, because I see some that like they almost make their membership tiers too complicated out of fear. So you want to
Yeah.
kind of have this sweet spot where it's not just 24/7 availability, unlimited visits for only 100 a month, but then it's also not like, okay, we have 10 tiers and then people get confused just reading your website.
Yeah. Yeah. Simplicity is your best friend.
Yeah, exactly.
So when at this point in your journey, when did you feel like revenue, so the money coming into your business, started to become predictable? That you're like, okay, I think
Mhm.
every month I'm gonna hit this much. Was that at the
Yeah.
beginning, or is there a point that you felt that it started being more predictable?
Yeah. I mean, the first year was kind of a mess. Like I opened, so I rented my space and I officially registered my business in like July of 2021. And then that first year I basically lost $50,000. I brought in maybe a few thousand and I spent like 50,000. So it was a net loss for, if I remember my taxes correctly, it was about a net loss of 50,000, which is a lot. I kind of consider that sort of my startup costs, right? And then year two, I think I was like positive 70,000. So I was bringing in more. And that was when I started doing the immigration exams, and that helped me a lot. I started paying myself. I remember my first check to myself as a distribution was $2,000, and it was so little compared to what I should be making, but it was the best $2,000 of my life, because I was like, I created this, like I earned it.
Yeah.
I'm paying myself, and then gradually went up from there. I would say that it was in year three that things really became much more steady, predictable. I was paying myself year three, I converted to an S corporation. I was paying myself as a W-2 employee. And my, salary was initially only 90,000 a year, which for many physicians, that's really low. But I was also investing into my company, and I was doing a lot of, I was running a lot of expenses through my business. And so all of the fellowship in integrative medicine, my clinical hypnosis training, my seminars that I would go to, even my MBA program in the last 2 years, I've run through. So the salary isn't completely reflective of really what I'm paying myself in terms of benefits, travel, conferences, education. I purchased a building a year ago, so that's an asset that will be mine, right? And I did eventually raise my salary more, but yeah, I would say it was in year three that I really got onto more steady footing financially.
Yeah, when you add yourself to like a payroll software and start getting back into the habit of like, hey, I get a check every 2 weeks.
Yeah.
That's nice. Opposed to like, okay, I
Mhm.
need money, so like I've got enough money in the business so I can take out a draw this month, and like
Yeah.
that like sustainability of like a consistent plan of how much you
Yeah.
pull out.
Exactly.
We try to help people think through, like as they're planning originally, what percentages that they can allocate towards the different things that they need. So how much
Mhm.
you can put towards overhead, and how much you'll need for your supplies versus, and how much we can take out in the beginning. And it's like if you can take out 15 or 20% of your revenue in the beginning, well, then
Mhm.
we have to budget for the other things to make that work.
Yeah.
But those breakdowns really help you kind of see of like, okay, I could start making this much as long as my plan goes according to plan, we
Hmm.
can make it work. And that's
Yeah.
where there's disparity, I think, is it's good to make a plan. We try to get people to like, hey, think through the panel size, the pricing, the time,
Hmm.
and how many people you can bring on per month.
Yeah.
The plan then helps you have some clarity and be able to evaluate performance of like, am I hitting the goals that I had made in the beginning to take out what I wanted to at the end of the year
Hmm.
versus making no plan and just launching and
Yeah.
feeling like you're just kind of in the waves of whatever happens. It's like, oh, I hope I have enough. And
Yeah.
that confusion can create a lot of stress and fear,
Hmm.
and also cause you pricing concerns. And, I'll lower the price so that I get this person so I can have enough money to do this. It's like when
Yeah.
we operate out of that fear, we make decisions that are not sustainable.
Yeah. I will just add as a side note, I did have a side gig my first 2 years because my income was so unpredictable from the practice and was actually a loss in the beginning. And there's that J curve of entrepreneurship, right? No matter what industry, no matter what business you are, you're going to have initial losses before your company becomes profitable. I had a side gig in urgent care. So I was doing PRN shifts in urgent care so that I could still pay my bills. I was the primary breadwinner for my family, and I was still paying off some student loans as well. I think those two things are, I've heard people say, well, I'm the primary breadwinner, I can't do it, or I'm still paying off student loans, I can't do it. And maybe in some cases that might be true that you cannot do it yet, but it shouldn't be a universal impediment.
Yeah. Well, we have a couple questions from
Great.
folks listening. I'd love to jump into those. One is for autism evals, were you able to obtain credentials to make autism diagnosis certified? So for them to qualify for insurance like ABA therapy,
Mm-hmm.
they said there's a huge
Yeah,
wait list for this everywhere, a big niche that's waiting to be
exactly.
tapped.
Yeah. So I had to take a training. I think it was through Children's Hospital of Philadelphia or Vanderbilt. I can't remember exactly, but I found an online training. It was a virtual training on how to do the ADOS, the Autism Diagnostic Observation Scale, too. And then I also trained myself by just buying the manuals to do the autism diagnostic interview. Now, there are a lot of different tools used for autism diagnosis. You kind of have to see in your state what's considered the gold standard by insurance companies and what will be accepted. And then I just kind of figured out how to write like this 12 to 15 page report collating all the findings and that has been accepted. And then I create sort of this prescription template for ABA therapy and a super bill for the family if they want to try to seek reimbursement through their insurance company for part or all of the cost. So yes, it's very state by state. I have talked to other pediatricians in the DPC space who say, oh, in my state, it's only accepted if it's from a developmental behavioral pediatrician. I'd say that that's rare. Most states, as long as the pediatrician is doing those accepted tests like the ADOS or the CARS 2 or the ADR, then and you have like an official report that you produce from that looks legitimate and it's from an MD or a DO, it will be accepted in most states.
Awesome. The other one is we talked about tiering memberships, talking about what is so you talked about vaccines in the very beginning, but what's your current setup now for vaccines for under
Mhm.
5 years old?
Yeah. So I have two vaccine options. I have VaxCare, which is that company. Basically, it's a vending machine for vaccines. So they ship us we already had vaccine fridges and freezers. And so they just ship us vaccines and they keep our inventory for each type of vaccine at a certain level per our request. And so anyone who has insurance, what we do is we go onto the VaxCare iPad portal that they provide us. We put in their insurance details, which is a bit of a pain in the butt because you have to, put everything in. And then you scan the vaccine that you want to administer, and it'll give you either the go ahead or a stop, like, no, we don't have a contract with this insurance, or this vaccine is not covered. 95% of the time we get the go ahead if the patient has insurance, and then it's basically a guarantee that yes, they have a contract and the insurance will pay VaxCare for the vaccine. So VaxCare doesn't charge us anything. With the contract with VaxCare, they send us the vaccines. We administer them, we put the patient's information in their system, then they bill the insurance company and get reimbursement for the vaccine. Plus they keep an administration fee, and we keep part of the administration fee. So they're getting a cut of profit from those administration fees, which are anywhere from like $10 to $30 per vaccine, something like that. And so that's how they make money. So we have VaxCare for the insured patients, and then we also have VFC. Every state has the Vaccines for Children program. It's a pain in the butt, and I didn't do it until I had a medical assistant who was willing to do all the paperwork for me and all the compliance stuff for me, because I knew that that was too much for me to take on and to stay on top of. So my medical assistant is in charge of all of the VFC paperwork and compliance and reordering and things like that. So for kids who have Medicaid or who have no insurance, we have VFC vaccines.
Another question, what tools did you take advantage of to help educate the public on the DPC model? And how long was your ramp up to launch from the time you decided to go with your DPC practice?
Yeah, I would say I made the decision in like June. I made it pretty quickly. I think I was just one of those, like, whatever you want to call it, deeper sense of knowing, intuition, that it was like, yes, this is the thing that I've been looking for all these years, and I'm going to do it. And I was terrified, like I mentioned, but I knew that it was going to be good for me, that somehow in some way it would work as long as I put in my end of the effort. So June I registered, and then in October I started to actually see patients. There's just a lot of stuff you have to do on the checklist. You have to register, you have to open bank accounts. I had to find a space, and then I signed a 3-year lease, and then I had to decorate the space. So that was like, when I wasn't working urgent care, I was in there painting my own walls and putting up wallpaper with my sister-in-law and husband, and buying furniture, some used, some new, and just decorating and getting everything set up. That took a while. And then also getting my city business license took a while, because they had to come and they had to do an inspection, and the fire chief had to do an inspection, and I don't know, they had to do some electrical inspection. And so those
Yep.
things kind of, like, I had wanted to start seeing patients in September, and then it took until October. So those things can take a little longer than desired. But yeah, it took from June to October for me to get all set up, start seeing patients. I would say I see people all over the place. Some give themselves 3 months, and some of them give themselves a year. So variable, but I would say on average, people need about 6 months to go from yes decision to opening. Another thing I'll say is, if you are employed currently, check your employment contract, because unfortunately there are non-compete clauses that are common in the physician community, and you don't want to get in trouble with your employer or end up getting sued because they're angry that you're going out on your own. So make sure you read. Then you can hire an attorney to help you look that over for you. Or you can use AI to help you interpret things that might be confusing. Yeah.
Awesome. Well, the last two things, I have a small plug here. If you've heard anything that you say, hey, I'd love to learn more and bounce ideas off of other DPC owners. If I want to ask questions of CPAs, but I don't want to have to pay the big fees for CPAs, we launched the DPC community. We call it the DPC Circle. It's really a place for DPC owners to get support from business professionals at a fraction of the cost, and also experience some community from other people going through similar things. There's lots of communities out there. There's lots of resources out there. And our goal is to just cut through some of that noise and give you a central place to get answers for tax and accounting and legal and marketing, as well as the benefit of group think and group minds. So if you're interested in that, you can go to goodmancpa.com/DPC-community. But also, Dr. Capella has a great resource with the DPC pediatrician. I'd love for you, if you want to share just a little bit how people could get in contact with you if they have interest in working together.
Sure. Yeah, so I created DPC Pediatrician. You can find it at dpcpediatrician.com about 2 years ago because I felt like this tiny little DPC pediatric community were kind of the ugly stepchild of the DPC community, and we needed our own kind of resources and things like that. And so it started out with just a startup guide. So there's a free startup guide specifically for DPC pediatrics that you can find there, get for free. We also have like courses. Some of them are free, some of them are paid courses on like the finances of DPC, how to like set your startup budget, how to set your operational budget, how to understand some of the legal and employment stuff in DPC. And then I'm also launching a startup foundations course in May. That will be a 6-month group coaching program that leads you, like basically holds your hand through the whole startup process, and you end up with your own customized business plan out of it. So we meet twice a month for 90 minutes. I review kind of the essential fundamental knowledge, and then you kind of have like homework in between that you can do for creating your own DPC practice. And you can find out more about that at dpcpediatrician.com, some other coaching programs and one-on-one consulting. If you ever want to just schedule an hour with me to discuss your ideas, your plans, or somewhere where you feel stuck, feel free to do that. My colleague, Dr. Phil Boucher, also offers consulting through the website. And we have a free podcast called DPC Pediatricians that you can check out. We've got a couple dozen episodes by now.
I love it. Well, thanks so much for hopping on, and thanks everybody else for joining and those that might listen in later. We're here to help you succeed. You've got this. So get out there, put your boots on the ground, and keep doing the hard work. So thanks everybody for joining today.
Thanks so much for everyone for attending. Thanks, Nate, for the invitation too.
Of course. Awesome.